Pharma, Big Pharma. I got a lot of questions about whether or not Big Pharma is on the take for every public health initiative. Now, as somebody who understands a bit about and certainly believes in the use of certain prescription medications, I find most questions about quote unquote Big Pharma to overlook the fact that there are thousands, if not hundreds of thousands of medications that save lives and enrich people's lives that are prescription drugs. I also believe, my audience knows, I say it over and over again, that better living through chemistry still requires better living. We still have to get our sunlight, get our sleep, social connection, good nutrition, exercise, and all those things. There's just no pill that's going to replace those.
Yeah.
Okay. But I think it's a valid question that people are asking. Is there a direct relationship between Big Pharma and public health initiatives in a way that should have us concerned about the messaging that we're getting and at times, and the fact that the United States consumes the vast majority of drugs for mental health, for instance, as compared to other countries? So that's one question. And then I want to dovetail into that question. What are your thoughts on the fact that, there's a history of, say, the tobacco industry being, very interdigitated, shall we say, with government policies in ways that had us basically injure, if not kill, millions of Americans, and then eventually say, you can't smoke near a hospital. You can't smoke anywhere. There's very few places where you can consume tobacco products. That kind of relationship and financial incentives, and then a lot of backpedaling later, I think wore on people's trust. So how should we frame the relationship between the pharmaceutical industry, government, and public health initiatives in a way that is, at least halfway functional?
Look, I understand where the concern and the suspicion comes from, right? And look, I think it's important that public health initiatives and medical advice is independent of the influence of industries that may seek to profit from what's being recommended or from medications that are being prescribed. And we have a history in medicine, right, of doctors who were, given gifts and vacations and all kinds of fancy things by pharma companies in an effort to influence what they prescribe. That was really problematic. And now we're seeing a lot less of that, which is good. A lot of rules that are being put in place by medical societies and professional societies and by academic institutions to say this is an unacceptable way to practice. And that's really important, because I do think that human psychology is that sometimes we underestimate how much we're influenced by incentives. We think, yeah, I'm getting that, but I know how to make independent decisions. But at the end of the day, we're human and we're influenced.
Or it's a great drug. It could be, wow, this is a drug that's really helping my patients. Okay. I'm happy to recommend it to them.
Yeah. So I want to separate one thing though. Like, taking money from pharma companies as a physician, I think is highly problematic, right? I think it's hard to say that it doesn't influence practice. Maybe it doesn't for some people, but it's really hard to know who those people are. I do think that separate from that, you can be a physician who prescribes medications because you believe they work. Look, as a doctor, I have prescribed many antibiotics during cases of infection that have helped my patients. And I would prescribe those again. I am glad that those exist. In many cases, they've saved the lives, of patients I was caring for in the hospital. So that's what should drive us is does the data show that they work, and does our patient need them, right? That's what should drive our decisions. When it comes to public health recommendations, here too, I think a similar principle holds, which is that I don't think that pharma money should be influencing our public health decisions, which means that it shouldn't be funding our public health organizations that are making recommendations. Certainly, I know this is obvious to you, but I'll say, just to be clear for everyone who's listening, like, our office doesn't take any money from industry, not just pharma industry, from any industry. Like, the money that we get is allocated by Congress at the end of the day. It's taxpayer money, and that's all we get. And that's important. We don't want money from pharmaceutical companies. But that's important because people need to know that these decisions are not being made for financial gain. With that being said, there's a broader concern I have, Andrew, which is I think that we have become a pill for every problem society, where we look for a quick fix of a medicine for every challenge that we may incur. And sometimes, yes, I'm a believer that if science, helps us create medications that can help solve disease, we should use them appropriately. But I think we discount heavily the behavioral changes that we need to make, the more broader societal and environmental changes that we need to make that influence our health. Like our food environment matters for our health. Our decisions about how physically active we are matter for our health. Whether or not we sleep matters for our health. And all of these impact our mental health and well-being as well. And so when I think about that bias, that to me is not always, stemming from money that came from a pharmaceutical company. Although I think the ads that we see all the time from pharma companies, I think, try to convince us that, hey, just take this pill once a day and all your problems will go away. But I think it's more complex than that. And I think that even for, in the healthcare setting, like if you're seeing a patient who has pain, who's having intense pain, it feels easier sometimes to prescribe a medication for that pain rather than trying to deal with non-medication based approaches or try to get the deeper origins of the pain. I'm not saying that's what doctors do all the time, but I'm saying that we're living in an environment and a broader culture where we, I think, increasingly reach for something that we see as a quick, immediate fix. And again, don't blame people for that. We'd rather take a quick fix over something that's going to take a long time. But I think it is selling us, I think, sometimes a false hope, which is that that's all we need to solve our problems. And I think a lot of times you need more. You need the behavioral changes. You need the environmental changes. That's one of my big concerns in terms of how we communicate about health.